Greetings. Welcome to this week's Wiretap. I am your host, Brad Einarsen, and I've got with me here Mike Melnick, User Experience Manager here at Klick, and Greg Rutherford, SVP of Marketing Strategies. So what we're going to be talking about today, it's actually two stories in the wire, but it's really one topic, and it's this idea of prescribable apps. These are apps, like the ADHD game that's in the wire. These are apps that try and take the place of other therapies and actually get a benefit. And Mike, I'd like you to talk a little bit about how can an app actually do that?
Well, what's interesting about these apps is that they're actually trying to replace the outcomes of a therapeutic medication. In one instance that your wire brought up was the ADHD medications. And what's interesting about these apps is that they're actually they're so well designed for the users in mind. So obviously ADHD is for children mostly, and the apps are designed in order to engage the child and really try to replace the therapeutic benefit of a medical treatment, which is very interesting.
Yeah, I think you got to put things in context, though. I think that with superior design and the newest in technology, I think it very much serves as a wonderful adjunct to treatment approaches that include drugs or other types of therapy. I think that you have to remember that in our current model, drugs are studied for a great many years and go through extreme rigorous testing with the with qualifying and quantifying appropriate patient groups right down to dose ranging and understanding adverse, serious, and not so serious effects. All that goes into a very, very well thought through process in terms of approval, and then guidelines and appropriateness follows. I think you can't replace all that initiative and all that effort and all that time with something that's not studied in the same approach. I think we're looking at in today's world and going forward is wonderful opportunities engaged in terms of personalized approaches, and also very much built upon incredible technology. I think we're going to see hopefully guidelines in terms of treatment that are going to include such devices or such opportunities in an adjunct type format with or process with existing drugs that we know have been studied and show improved patient outcomes. This is like adding therapy or cognitive approaches to drug treatment, and I think there's a place for it, but I think it's going to be driven by guidelines, and I think it also has to be studied with and without different types of treatment to understand its overall benefit or delta.
Absolutely, and that's where the clinicals come in. These guys, the subtext in the article seemed to be that the guys with this ADHD app wanted to actually run a clinical and see what therapeutic outcomes they could get. And I mean, look, if regardless of where it comes from, if the therapy actually has a therapeutic benefit, then it would make sense to allow it to be prescribed, I would think.
Yeah, I think the analog I use, and I haven't seen it cited anywhere, but I'll just go back to some areas I used to work with in my past. When you've got seasonal affective disorder, very much a situation in certain environments like British Columbia, for instance, or the West Coast, where there's a lot of rain and a lot of cloud cover. I think the thinking today is that is very much treated with light therapy, but it's also with adjunctive approaches, including drug treatment therapy, and there might be other types of therapy. So I think we have examples out there where treatment includes a number of different approaches, and I think what I'm starting to get a sense of is some of these things that are being developed today that show great promise are to be used in inclusion with and not standalone in lieu of a replace. And I'd be way more comfortable approaching things that way.
Absolutely.
Yeah, no, I agree. I also feel strongly that the app approach has definite advantages over a traditional treatment methodology, meaning that with children especially, there are opportunities within an app environment to include some gamification and some incentive. Obviously a lot of the drug companies run into issues with adherence and compliance on the therapeutic plan. So in the context of an app, taking that analogy and applying it to the game design is very interesting. Meaning, the reward structures are structured in such a way such that it encourages adherence to a plan, and obviously improving the outcomes being the end game.
Yeah, and I think as well that the entire trend in medicine today is about personalization. It's about improving access, and it's about understanding there's no standalone approach in most cases. It's a combination effort, and it includes a number of different things. And I think with technology the way it is today, and with the ability to become personalized and gain access to various approaches, I think it can only add value to treatment. But it's important that everything gets measured, and it's important that patient outcomes are the main focus.
Yes, absolutely. And that's where the second story comes up. This WellDoc has convinced a couple of insurance companies to pay $100 a month for patients to be on their app, which is Diabetes Manager. So they must have, they've had some press releases that show they've done studies where you get reduced hospital visits and things like that. And that seems to be talking specifically to your thoughts there about adherence, gamification, the ability for the app to drive that behavior.
Yeah, I mean, we're seeing a lot of innovation on the mobile space, and I think that this kind of use really aligns with the move in our society at large to a more mobile-based environment. And with the rise of all these digital apps, people are getting more and more used to having an app in their pocket that they can kind of whip out and just do whatever they need to. And you're looking at the pervasiveness of smartphones in people's pockets across North America and the world as well. So this kind of app kind of jumps or dovetails onto that habit that people are kind of taking their phones everywhere and using apps wherever they go at any point in time.
Yeah, and I think on one hand you're talking about personalization and access, and because of the popularity of mobile devices today and the ability to download anywhere, then as technology improves, I think we're going to see more and more access to great and wonderful things that are going to enrich and improve our lives. But this is no different from an insurance perspective that's really looking at improving patient outcomes and reducing risk. This is no different than programs in the past that were meant to curtail risk behavior, drinking, smoking. This is about providing through technology better access to understanding, maybe through a diary approach or a tracking approach, to better understand that if you continue to do the right things and measure the right behaviors, what the real beauty of this is in time you're going to be able to show quantifiable results. And when you showcase those quantifiable results back to a healthcare provider or back to an insurance carrier, they can therefore make decisions with respect to the improvements. And I think that's what this does. This puts that improvement capability, the ability to showcase it in the hands of the individual patient. I mean, back in the days when I worked in respiratory, patients were manually filling out their asthma diaries, and they were measuring their FEV1 or FEV2 or peak flow scoring. This is no different, just technology has enabled us. The whole trend in the marketplace is going towards health and wellness, and it's about empowering everybody based on what's available today technology-wise to lead better and more productive lives from the perspective of doing everything they can to ensure that they improve their own outcomes. And this is just one of probably many examples. I think what's interesting is, in time, I think you're going to see insurance carriers demanding more of this thing, more of this approach from all the people who they insure, because they're probably now very similar to the model, at least in my neighborhood, or my carrier recommends, which is, if I have an alarm in the house, I'm going to pay a lower annual rate, and that's because I'm doing preventive, and I'm approaching a certain way. Why wouldn't we treat our own approaches to health and wellness the same way?
Another fringe benefit to all this reporting, I mean, sure, it's self-reported, but it still is feeding a massive bank of data.
Yeah.
Right, so all that data, the richness of the numbers that we're getting out of all these apps allows us to report on a personal level, on the physician-patient kind of relationship, but also at the aggregate level. So measurings have been improved through the apps is actually quite easy if the analytics are in place.
Yeah.
Obviously the data is self-reported, but there's still a lot of value in it for sure.
Well, and just to piggyback off that, so we know the entire marketplace is moving towards electronic health record keeping, and we know that everybody as an individual is going to have their own personal health record capability, And I know through Bluetooth technology and a bunch of other opportunities that currently exist and will exist in more readily fashion tomorrow, we're going to be simply building our own personalized health profile. And then all that actually feeds into that aggregate data that helps us with outcomes data. And pretty soon people will be incentivized to do the right things, and in doing so that incentivization might also manifest itself into lower annual rates and maybe more opportunities to be included in certain things and maybe excluded from other things. So I think that's where the market's going.
Well, everybody's in favor of lower rates. So thank you guys for being here this week. And that's it for Wiretap for this week. Thank you so much.